The growing heroin epidemic across the country is affecting more than just the people who are using the drug. Hospitals are having to devote more time and resources to treating babies born into addiction. News 8's Keely Arthur joins us now in our newsroom with a look at the situation locally.
Mike, the number of babies born with exposure to heroin, known as neonatal abstinence syndrome, doubled between 2008 and 2012, according to the Wisconsin Department of Health Services' latest report. With a growing number of instances right here in our community, doctors say they are changing their approach in hopes that both mother and baby will eventually be drug-free. Most babies are born into the world with a clean slate, but a growing number of newborns in La Crosse County are starting their lives off dependent on heroin.
I now see more babies with addiction in our community in 6 months than I used to see in 10 years.
Mayo Clinic Health System in La Crosse reported 10 cases of heroin-dependent newborns last year, and nearly all of those babies face withdrawals, just like recovering drug addicts.
And some days are very hard on them. High-pitched cries, diarrhea, diaper rashes.
Now hospitals in our area are trying to treat drug-addicted mothers right at the start of pregnancy.
And that's when most women choose to seek care.
Jean Colburn, a registered nurse at Gunderson, is currently working with 35 women who are pregnant and dealing with addiction.
They get into a medication-assisted program and get switched to either methadone or Subutex or buprenorphine.
Those prescriptions help expectant mothers combat heroin addiction and are less harsh on babies.
Because we know exactly what they're getting, how often they're getting it, and it's managed.
Colburn says this kind of treatment program often jumpstarts a road to recovery. She works with moms and babies for about 2 months after birth and ensures they will have access to long-term treatment after that.
Whether it's pediatrics, behavioral health, outside agencies, so that they can be successful.
Both hospitals admit this kind of care is costly. However, they say babies who are truly addicted to heroin have much longer hospital stays rather than those on the prescriptions, and the goal of this care is to prevent further medical issues related to drugs and help mothers fully recover from drug abuse, potentially saving money down the road.
Okay, thanks, Keely. Doctors are required to report babies who test positive for drugs to Child Protective Services. However, if the mother tests positive, a doctor may report her, but is not required to.